Guys, it's Shelby Croton with Matt Ace's LLC lesson program, and today I would like to talk about healthcare records. Why do you need healthcare records? Well, this slideshow will show you why, what to include, and all of the above. So let's go ahead and get started. What are healthcare records? Healthcare records are meant to help prevent disease and problems. These records include, but are not limited to, immunizations, regular deworming, and dental care. To keep your horse healthcare up to date, you'll need a calendar and a record book. If you contact us today, we can design a record book that's specially designed for you and your horse. Mark all the dates that immunizations, deworming, and farrier visits are due. Call for appointments at least 1 week ahead of time out of respect for your healthcare provider. All veterinarian visits and other healthcare should be recorded in your record book. Write down the date, what was done for that horse, which horse, and any other notes or instructions that was given to you by the healthcare provider. Immunizations. They're also known as inoculations, vaccinations, or shots. These protect your horse against certain diseases. A product used to immunize a horse is called a vaccine. They work by stimulating the body to produce a substance called antibodies, which can fight off particular diseases. Not all vaccines are 100% protection, but they give a horse a much better chance of avoiding a disease, and should your horse get the disease, he will have a milder case. When a horse is first inoculated against a certain disease, 2 or 3 weeks may pass before the horse develops enough antibodies for the immunity for the disease. Immunity may last for as long as 1 year to as little as 3 months, depending on the product that was given. It is very important to know how long the immunity will last for each inoculation and how often your horse needs a booster shot to keep up the horse's immunity. So make sure that you talk to your vet about that. Every horse should be inoculated against the most common and serious diseases at least once a year. Keep in mind that some diseases are more common in certain areas. If your horse goes to a lot of competition, they may be exposed to different diseases for those areas. So always ask your vet before competitions what diseases are common in your area that you can protect your horses from, or in areas that you are traveling to. If they don't know the answer, they will surely find you the answer, and they will recommend inoculations and how often the boosters are needed for your horse. Basic inoculations all horses should receive. Tetanus. All horses should have a tetanus shot once a year, and a booster may be necessary if your horse gets hurt. Equine sleeping sickness. There are 3 types of sleeping sickness: Eastern, Western, and Venezuelan. All horses should be inoculated against Eastern and Western types. In the North, 1 shot is given in the spring. In the South, shots may be given every 6 months or even every 3 months because of the mosquitoes that spread the disease. They're active all year round. Horses can get flu just like us humans. So it's very important to protect your horses, especially if they go to competitions a lot, where they're exposed to other horses that may have this disease. Immunity only lasts 3 months, so a booster shot should be scheduled as accordingly to your competition schedule. So keep that in mind. Rabies. If there are any rabies in the wildlife in your area, all horses must have a rabies shot. So talk to your vet. They'll tell you. Other diseases to protect from. One of the biggest diseases to protect from is this one right here. Strangles. I had a horse that got strangles and we almost lost her. Younger horses that fight strangles, it's a little bit easier on them. Where older horses, it takes a little bit more out of them. My horse for strangles, she showed signs of swelling in her throat area. She had a fever. She was lethargic. She didn't want to eat or drink. I called the vet as soon as we knew that something definitely was up, and he put her on antibiotic. Some vets will make you wait for antibiotic until after pus pockets burst, which I highly recommend. But it's kind of up to you and your vet and the actions that you guys would like to take. Combined vaccines are available that inoculate against 2, 3, or even 4 diseases in one shot. Ask your vet what they recommend. I want to talk a little bit about healthcare schedules. Some people don't really follow healthcare schedules. Healthcare schedules are really important. You want to follow healthcare schedules for new horses. This is a pre-purchase exam by a vet, which checks for health soundness, a Coggins test, and a test for equine infectious anemia. You want to make sure all their inoculations are up to date. For first-time inoculations, 2 shots 2 weeks apart may be required. And remember, 2 to 3 weeks to develop immunity. Have the horse's teeth checked by a vet or dental specialist. And a farrier check, of course, to make sure that their feet and shoes are ready to go. A trim and reset if necessary. A big one for us at our training facility is to keep the horses isolated from other horses for at least 2 weeks possible. These are new horses that are coming in, as well as deworming a new horse at least 24 hours before you let them out to pasture. Your annual checkup, sorry my lines are all crooked. Your annual checkup is for all your basic shots: tetanus, sleeping sickness, rabies if needed in your area, a Coggins test, definitely if it's required for travel or some events require it. I always keep mine up to date. You should probably too. Any other inoculations your horse needs that your vet recommends for you to give. Every 6 months. That checks for teeth and if they need floated. Every 3 months is a really good schedule for you to deworm your horses on, unless your vet suggests that it be every 2 to 6 weeks. Rotate deworming products as your vet recommends. Every 6 weeks is for your basic farrier visits, and also deworming if your vet would like you to deworm on a smaller schedule. Internal parasites and deworming. In this slideshow, I talk a lot about deworming. Deworming is a really big thing. Parasites can cause severe colic. So this is a big thing to watch for. Horses are exposed to internal parasites, which are also known as worms, all the time. They must be dewormed on a regular schedule or they will get thin and unhealthy. So those are 2 big signs to look for. Worms can cause damage to the horse's blood vessels, intestines, heart, and lungs, which can lead to fatal colic. 90% of all colic cases are believed to be caused by the damage done by parasites, especially large strangles, which are also known as bloodworms. The life cycle of a parasite rotates and continues all the time. So it's good to remember these. Each type of internal parasite or worm has its own life cycle. Mostly large numbers of eggs or larvae in the intestine. They are then expelled from the body through the horse's manure. The eggs hatch into tiny larvae, too small to be seen by the human eye. They take several weeks to develop into infected larvae, which will crawl into the blades of grass, which the horse eats the grass, of course, and it eats the larva. Once inside the horse, different parasites live and develop in different places. Some of these parasites live in the lining of the intestine, others migrate through the blood vessels to other organs. Most adult horses, their parasites live in the digestive tract, where they suck the blood or live off of the digestive juices. Gross, right? They damage the digestion, making the horse unable to absorb nutrients from their food properly. These parasites can also damage, like I said, blood vessels and other internal organs. In this photo, I show you the steps of the stages. So number 1 is the poop with the grossness, right? Poopy, not good. Which then it comes down into stage 2, which is the worms and the larvae that are infected. Then your beautiful little unicorn, that's what I call mine, they eat it. Ew, gross, they eat it, and the immature worms migrate in the tissues. So tissues. Then it goes, so after it's like living in the body, then it comes right back out into the manure, and the process happens again and again and again. Let's cover types of internal parasites. Like I said before, you have large triangles, which is bloodworms. These invade the blood vessels of the intestines and cause serious damage to the blood vessels, digestive tract, and other vital organs. Damage from these parasites is the most common cause for fatal colic. Small strongholds, also known as the bloodworm, they can cause damage to the blood vessels and internal organs as well. An infected horse may have a pot belly, dull coat, signs of anemia, diarrhea, or even colic. Roundworm. These are large worms that live in the small intestine. They are more commonly found in foals and young horses. These parasites can cause coughing, inflammation of the lining of the intestine, and even a rupture of the intestines. Bots. The larva of a bot fly lays its eggs on the hair on your horse's legs, shoulder, and chin. These eggs hatch and the larva enters through the mouth, like when your horse is biting their shoulders or if they scratch their legs with their mouth. So they are then swallowed. They mature into bots themselves, which attach themselves to the lining of the stomach and can cause ulcers. They eventually are excreted into the manure and they hatch into bot flies that fly around and bug the crap out of us. Pinworms, these live in the end of the large intestine. They irritate the rectum and can cause the horse to rub their tail. A dry, gray, yellow discharge is a sign of pinworms, so make sure you keep an eye out for that. Your vet can test for worms in your horse's fecal matter. This test will tell you the parasite that your horse has, how many are present, and it can also help you decide what kind of dewormer should be used. Ask your vet how often your horse should have this test done. Dewormer must be given to horses on a regular schedule. I will repeat that probably 5 more times in this slideshow. Usually every 8 to 12 weeks, different wormers work against different types of parasites, and at certain stages. So you should rotate and you should read the label and choose a dewormer that is going to best suit you. Always rotate your product. That way that the worms don't get used to the same product over. Dewormer in itself can be given as the paste, powder, or pellets. It can be added to the grain, given through the mouth, or a stomach tube, which can only be done by your vet. When giving dewormer, it's important to know how much your horse weighs. That way you can give them the proper amount. Parasite control. Parasite control aims at keeping horses as free from parasites as possible by breaking the parasite's life cycle. So this involves regular deworming, good pasture management, and keeping feed and water from becoming contaminated by manure. Worms, their eggs, and their larvae are carried in the horse's intestines, like I said before, and excreted through the manure. A single pile of manure can contain thousands of parasite eggs and larvae. Gross, right? To keep your pasture from becoming contaminated, you should deworm a new horse 24 hours before you turn them out to pasture. To reduce worm problems, like I've said before, deworm on a regular schedule, following your vet's advised schedule and products to use. Avoid keeping too many horses in a small pasture. Horses in a very large pasture or on rangeland are less exposed to horses in a smaller area, especially many horses in a smaller area. A lot of horses in a smaller area will lead to this next one, which is avoid overgrazing. Horses will not eat grass near manure unless all the grass is gone. Rotate your pastures to give each pasture a rest. Fun fact is horse parasites cannot live in sheep or cattle. Manure should be picked up from paddocks or pastures at least once a week. My horses live on a really big pasture, so I'm not as concerned to pick it up as if they were living in a smaller area. If your horses are in a stall, corral, or even a really, really small area, make sure to pick it up every couple of days. My grandfather's rule of thumb was every day while they ate. Keep your horses' hay and feed off the ground in buckets. That way it alleviates manure going into those feeds and hay. Also, keep your water clean. My horse has occasionally pooped in her water, so I always make sure to clean my water at least every other day. Now I want to talk a little bit about dental and teeth. I'm going really fast through these slides, so if you would like a copy of these slides, please let me know and I would gladly send you the slides. Teeth and dental care. A horse must have a healthy mouth. This is in order to chew their feed properly, to stay in good condition, and to be comfortable with a bit in their mouth while you're working them. You must know enough about your horse's mouth and teeth to keep them healthy and comfortable, and to recognize a problem. Your horse's teeth need regular care from a vet or an equine dental specialist. The anatomy of the mouth, the horse's teeth and mouth are designed for grazing, of course. The lips pick up the grass, the front teeth tear it off, the tongue passes it back to the back teeth, which then grind it up and it's swallowed. On this slide, I show you a basic picture of an equine skull. These are incisor teeth, which are the front teeth. Then we're going to go into the canine tooth or teeth, which are like the same as in dogs and humans. Fun fact about these, they're only found in male horses. Some mares do have them, but mostly in males. Your wolf teeth are premolars. They're very tiny, tiny teeth. And then you have your cheek teeth. That's the basic set of teeth, which are 3 premolars and 3 molars. On this slide, I include a couple photos of bits in the horse's mouth. I'd like to talk about each one with you. This right here is a double jointed, also known as a dog bone. These are more comfortable for the horse's mouth. As you can see in the photo next to it, the single joint essentially makes a point that hits the roof of the mouth, causing discomfort and pain. In this photo, actually, we're going to go to this photo. This is a straight bar with a ported mouth. As you can see, it fits nicely into the roof of the mouth, allowing the tongue to fit nicely in it. Me as a trainer, I prefer to use a dog bone, double jointed bit, or even not a super high ported mouthpiece, but a ported mouthpiece with a straight bar. I try to stay away from single joints because it does add discomfort. In this photo, it shows the 3 molars and the 3 premolars, which is 6 on each side and 6 on top on each side, 6 on bottom. Your canine teeth and your incisors in the front. This shows where a bit sits. It sits on the bars of the mouth. The teeth that you should know are, there's 12 incisors, front teeth, like we said. There's 6 on top, 6 on bottom. Premolars and molars, there's 24 total of these, 12 on top and 12 on bottom. Canine teeth, or tushes, not tushies, tushes, there's 4 of these. They're usually found in male horses, although a few mares will have these teeth. Wolf teeth, some horses may have 1 to all 4. These are small extra premolars at the front of the premolars. These cause discomfort if the bit touches them, and they can be removed by your vet. Then you have the interdental space. This is the toothless space between the front and the back teeth. This is where the bar of the mouth sits on the upper surface of the lower jaw, which is where your bit rests. This is a very sensitive area in the horse's mouth, so you should use caution. Baby teeth and premature teeth. Horses start out with baby teeth just like us humans. A foal is born with both sets of teeth, like humans. First, the baby teeth grow through the gums in pairs between ages of birth and about 9 months old. The premature teeth are also growing during this time, but they do not expose and work their way through the gums and push baby teeth out until a horse is roughly 2.5. Usually all baby teeth have been lost and all permanent teeth have appeared by the time the horse is 5 years old. At this time, it is said that the horse has a full mouth. Tooth growth and wear. I find this very interesting, and I've learned a lot from my vet. Horse teeth are constantly growing and wearing down. Each tooth has a long root that really reaches into the jaw. Each tooth grows by breaking through the gum and grows until it's long enough to meet the opposite tooth. As the teeth grind together, the surface of each tooth keeps wearing down at about the same rate that the tooth grows. So it's not a big change that you see. As each tooth grows and wears down, its appearance changes as new parts of the tooth appear. This makes it possible for us to tell a horse's age by the shape and markings of the teeth. But this is only done until the horse is about 8 years old. At 8 years old, the changes in the teeth are not as consistent, and the age can only really be estimated from 9 up. Some vets are really good at telling ages though, so it just kind of depends. A horse's upper jaw is wider than the lower jaw, and it's wider in the back and narrow in the front. The teeth grind sideways in one direction. As the teeth wear down, sharp edges or hooks can form on the upper and lower teeth. These hooks can make the mouth sore and can cause discomfort. It also makes chewing really difficult, which can cause a horse to lose weight. In this photo, it shows both the lower jaw and the upper jaw. I like this photo and I chose this photo because it really shows the incisors on both top and bottom, the canines on both top and bottom. On the upper jaw, it shows the wolf teeth. This horse obviously has 2 of them. They're these tiny little teeth at the premolars. Then you have 3 premolars and 3 molar teeth. That is 6 on this side, 6 on this side, 12 top, and 12 bottom. Your dental care for your horse should be checked by a vet or an equine dental specialist every 6 months. If sharp edges or uneven teeth are found, they should be floated or filed down with a special rasp or tools. This procedure does not hurt your horse, but they may not like the sound of the tools that are being used, but it'll make their mouth feel more comfortable. If you allow your horse to have a really good experience, the first experience when they're young, it shouldn't be too big of an issue, but drugs can be administered by your vet or equine dental specialist. Besides scheduling regular checkups, you should watch for signs of the mouth or tooth trouble. What you should look for: if a horse loses weight or fails to eat like they normally do. You know your horse, you know how they eat, so if there's a change, it possibly could be from mouth issues. If a horse's mouth is sore, they may let food fall out the sides of their mouth while they're eating. So when you go to feed your horse their grain and they normally eat their grain really fast, and you go back out to check to like take their bucket in 10 minutes later and there's still grain in the bucket, it could be caused by mouth problems. They may become touchy or difficult to bridle. Keep this in mind though, some horses are difficult to bridle anyways because of a bad experience. So know your horse. Bond with your horse to know, oh, my horse is normally really good with bridling, and right now he's struggling. I may need to call my vet. They may not want to accept contact with the bit either while you're riding, so that's good to know. They may brace themselves against it. They may lift their heads really high so that there's no contact between that. If you're a high enough experienced horse owner, you will be able to put your hand in their mouth to feel for the sharp edges or even feel on the outside of their face. I do not recommend for beginner riders to go sticking their hands in their horse's mouth. I've had a lot of experience, and I even get nervous sticking my hand in other people's horses' mouths because I don't know them as well as I do my own. Let's review. Why do you need a record book? What should your record book include? How do vaccines work? How many weeks pass before a horse develops enough antibodies for immunity? What is the longest and shortest that immunity lasts? What are the basic inoculations all horses should receive? What is one other disease your horse should be protected from? There's 4 total on the slide. What are the 5 healthcare schedules you should follow? What damage can worms cause to your horse? What % of colic is believed to be caused by damage from parasites? What are the 5 stages of the life cycle of a parasite? What are 3 types of parasites? What is the usual deworming schedule your horse should be on? What is included in parasite control that will help your horse stay as free as possible from parasites? What are other ways to reduce worm problems? How many incisors does a horse have? How many premolars and molars do a horse have? How many canine teeth would a horse have? And where are they more commonly found, male or females? How many wolf teeth can be found in a horse's mouth? What is the toothless space between front and back teeth? What are the bars in a horse's mouth? When do baby teeth come in? All baby teeth are lost and permanent teeth can take their place. By what age? Once a horse turns blank, the changes in the teeth are not as consistent. Teeth grinding, blank, can cause blank, making the horse sore and make chewing blank. How often should a horse's mouth be checked? What things should you look for in dental care to know your horse is having problems and needs to be checked? You can go ahead and get these worksheets with all of these questions at our Mad Aces LLC lesson page on Facebook. Print them off, answer the questions, and turn them back in either via email on that page, or you can send us an email directly to madaces@gmail.com for your chance to win a prize. Thank you, and I hope you enjoyed this video and have a fantastic day.